This might shock you, but here's how to fix pediatrics in the last 15 days. Talking about one of the very chota cute subject pediatrics that yields you around 8 to 12 questions in INICET as well as NEET. For rapid revision, you can go for Dr. Anand Bhatia sir or Dr. Singaram sir's videos, and for PTR, you can definitely go for Dr. Zenavora ma'am's PTR. Now, talking about the three main core important sections of pediatrics are neonatology, that is going to yield you around 4 questions. Then comes the growth and development part, and then the systemic part. Talking about neonatology, it is very easy, and most of the times it is more and more factual. You have to be very thorough with certain topics that I have listed here. Neonatal jaundice, combine it with medicine. HIE, the classification, SARNet and SARNet, very, very important. NEC, Bell staging is very important. Respiratory distress syndrome, along with Downey's and Silverman scoring. Last time there was direct question, 2 direct questions in INICET May 2024 on the same. And EBGAR score is something that you have to must read before going for this INICET exam. Along with that, next is growth and development. Milestones. It is one of the favorite topic for INICET. Every time one milestone will be coming, you cannot go without revising the milestone on the last day. Even in the morning, you have to revise the milestone. Reflexes, very important. Protein, energy, malnutrition. One of the question will definitely be coming from here. Breastfeeding. Arm span and upper segment versus lower segment. This can be asked. This is something that was asked in last INICET also. So this has high probability to get asked. And height and weight according to the age. They will be directly asking you these questions like at birth the age was at birth the weight was X. Tell me what will be the age at 3 years. Tell me what will be the age at 3 years. Next is the growth chart, that is again very important. Combine it with PSM. Last is the systemic. Now in pediatrics, the systemic का जो trend है normal medicine से थोड़ा different है. यहाँ पे CVS ज़्यादा important है. Cyanotic heart disease, one question definitely. INICET also, NEET also. Rheumatic heart disease. Then GIT, ORS पे पक्का question आता है. Dehydration पे तो पिछली बार INICET नवंबर में 2 questions were on the same dehydration topic only. Renal, nephrotic and Henoch-Schönlein purpura, along with respiratory, that is asthma and cystic fibrosis, along with the other important topics. Now, in pediatrics, you have to remember, you have to focus on more and more PYTs rather than PYQs. There will be certain PYTs that are repeated again and again. For example, developmental milestone, vaccinations, nutrition, common pediatric emergencies like seizures. Okay, all these things, vitamin A deficiency, these will be asked, and they have been asked from a long time. They will be asked this time also. Then volatile topic revision like the developmental milestone, the scores, X-rays and CT, very important. What you can do, you could have the images stored in your tablets and then you can revise them on the last day. TSM programs, very, very important. Try to club as many as programs you can club. I feel that SARS program can be asked this time, or the sickle cell anemia program can be asked this time. Integrated with medicine, anatomy, surgery, as well as with ortho, as much as you can. Surgery say you should remember the GIT portion is very important, especially the appendicitis pala part is important. Anatomy say the embryological aspect, especially the fistula, tracheoesophageal fistula wala part, again GIT part is important. Medicine, entire systemic is important, and ortho, upper limb and lower limb fractures are important. And daily supplemented with more and more questions. Just remember, pediatrics is one of the very high yield scoring subject that will be yielding you around 8 to 12 question. If you get them right, the rank shift will be direct. एक क्वेश्चन भी सही करते हो ना, आपकी अगर 5000 रैंक आ रही होगी, you can also land below 1000. So please remember, one score makes a very important difference in INICET. So keep revising and see you soon in the last 15 days strategy. Bye, take care.